video that you're going to see is a clip from my manual therapy workshop where I'm showing you a patient of mine who had an amputation and a fracture of his fingers and what we're doing in the manual therapy course. Check it out. Mauricio had an amputation of the index finger, right? And they had a fracture of P1 and P2, and he had pinnings. When? And a flexor tendon, right? And after a while, he developed trigger finger because all the scarring, all the trying to flex, he developed trigger finger. So then he went and had a trigger finger release of all of his fingers except for the index finger. So if you want to feel someone who's a little bit on the tight side, one of the things that I like to do is when I'm working with someone's hand, I like to put my fingers in between their thumb and their finger so that I can control the wrist and I can control the thumb. So if I'm working with someone and they start pulling their thumb in, I say, hey, relax, right? And then I have full control. So if I'm trying to stretch the MPs here, you can see from the skin blanching that it's a little tight, right? So with Mauricio, one of the things that we do, and this is a great move for anyone who has trigger finger, anyone who has a stiff hand, who has a painful hand. When you do a distraction and a dorsal glide, and you should feel it on him, it's hard. And what you want to do is feel it on someone else that's loosey-goosey, and then when you feel it on him, it's hard. You can feel that it's stuck here. It doesn't move that much, right? And what I could do is I could distract, do a dorsal glide, and then in that position, I could hold it. See, when you work with your hands, think about how you can spread your fingers wide, right? How you can use your whole hand. So it's a distraction, dorsal glide, pull it back, and then now hold it. Now, if I hold it here, I can use my other hand to massage, like I'm multitasking. Now, does this feel good?
Yes.
Or does this feel better?
No, the other one.
The other way. So you can go into some scar, right? So again, you can work the tissue towards ease versus restrictions, right? So I go like this. After several repetitions, if I go down, does that feel better? Right? Someone with scar, you can work moving ulnarly or you can move radially. Which direction feels better? This way?
This way, yes.
And over time, you could feel it, right? So come and take a look if you want and practice on Mauricio. So you can practice that move with him, right? So first practice on each other, but also come and try on Mauricio. Mauricio is going to tell you if you're too gentle or if you're too hard, right? So relax, and you could do it to all his fingers. So he's tightest here, then here, and then this is not too bad, right? And then you can also take him and you can roll. So does that feel good? Or does this feel better?
This one.
This way, right? So you can practice on him and he'll tell you, oh, does it feel too soft? So you tell him, so that to change how they move, right? Now, if you're short like me, I like to sit. Sometimes when I'm doing this, I'm by their side. Sometimes you could do it in front of them, but I want you guys already know how to do it in front. So do it on the side. You'll be surprised at how much control you have of someone's hand. If you're tall, then you want to use a rolling chair to sit down and move. And you see how when I work, my arms are by my side, right? So I'm not, and I'm using all my hands. So think about how you would use all your hands. If you're a therapist and you're looking to develop your manual therapy skills, working with all types of hand to shoulder injuries, check out the link for my events, my 2-day workshop that I'm going to be all over the United States and even the UK in 2024. I'm going to leave the link below so you can see the dates and times and locations, and I hope to see you at an event.